Hi, my name's Hannah. I'm a doctor and English teacher from England. In today's video, I'm going to talk about OET speaking and give you some phrases that are useful for Part C of the communication criteria of providing structure. This is part of a little mini-series. I have 2 videos already detailing some phrases for Parts A, relationship building, and Part B, patient cues. So this is a continuation of that. Now, as I've said in those other videos, it's clearly not going to give you very good marks to just memorize phrases that you've seen on the internet. However, what I do want to do is give you some really useful phrases, explain the context where these phrases are useful, and therefore you can go away and adapt them and change them to make them specific to any OET speaking card. Okay, so let's dive right in to the indicators of providing structure, the OET speaking communication criteria, Part C. So as usual, I'm using the OET official glossary document that is on their website under the speaking section, which shows exactly what skills they want to see you using to get top marks. I often think that providing structure can be a little bit overlooked when you're thinking about communication skills, but having a very strong structure and demonstrating to the examiner that you have a structure in your head and you have the communication skills to be able to be flexible but ultimately stick to your structure is a way of showing that you have control over the consultation. And if you have control and you feel in control, you'll then find that you'll be more fluent, you're less likely to stumble over your words and make pronunciation errors, and you're more likely to be able to show off the other skills that you need to show in order to be able to get good marks. So let's dive right in. Firstly, sequencing the interview purposefully and logically. Now, luckily in OET, as you know, you'll have a speaking card. There'll be bullet points of what the exam wants you to cover. And overall, you can sequence the interview logically just by following the order on the card. It is pretty straightforward. However, you do need to be flexible and you do need to be able to respond to the patient appropriately. It would be quite common in your exam for the interlocutor playing the role of the patient to skip ahead and ask a question about a bullet point that's much further ahead in your card. And this is not a disaster. You have 2 options of the way to deal with this. First option is to stick with the order in the card. So you can say to the patient something like, "That's an excellent question. Do you mind if I come back to that after clarifying a few things with you first?" So that way you're keeping that control, you can keep with the order of the card, but you're still acknowledging the patient. However, it might be more appropriate, given the unique circumstances that you are present with in the exam, to instead answer the patient's question and then come back to where you were on the card by using a phrase such as, "We touched on this topic earlier, but before we continue, can you tell me a bit more about whatever?" Or just a quick, say you'd nearly finished all of your questioning, but the card wants you to ask about allergies, but the patient has already moved on to something else with their question to you. You can just say, "Can I just double check if you have any allergies?" The next section is signposting changes in topic. Now, signposting is a huge area in clinical communication skills, and it's really worth, if you have the time, to just give it a quick Google and learn a bit more about it. But ultimately, signposting is just telling the patient what's coming next. So the simplest example of using this skill would be, "I would first like to ask you some questions about your general health." So you can use this straight after you've introduced yourself to the patient, and you can just signpost essentially what's on your first bullet point. And clearly, you don't need to do this for every single bullet point on your card. But there are some specific circumstances where signposting is particularly useful. For example, in real life, I'm sure you've come across it where you go to see a patient and they immediately ask you some random question which can completely throw off the consultation. And signposting is a really great way of kind of stepping back and saying, in a very polite way, but this is how this consultation is going to go. You know, you are showing that, again, you have the control and that you will answer all of their questions as best you can, but you as the clinician are going to control the order of that consultation, more or less. So for example, firstly, I need to clarify a few things about your medical background. With this information, we can then plan how best to help you. Another good use of signposting is to use it as a transition between topics. This is very useful when you have two bullet points that don't necessarily fully logically follow on from each other. So to transition between the two bullet points, you can say, we've spoken about your chest pain, for example. Now I would like to ask about how this is affecting your daily life. And we can build in patient cues, so we can be getting two lots of marks for the price of one phrase. And if they've said something earlier about worries, for example, we can then build on that and say, you mentioned earlier that this was really worrying you. I would now like to explain how we might address those concerns. And with a phrase like this, the examiner, when they're marking this at home or in their office, should be like tick, 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 because you're showing empathy, you're showing to the examiner that you've been listening to what the patient said, and then you've signposted and moving on to the next topic. And in real life, this transition signposting is very, very useful in terms of time management. And also in the OET, if they were to challenge you with a patient who's talking a lot, we all know those patients who just want to give you every little detail about their symptoms. And a signposting phrase can be really helpful to signal to the patient, I've got enough information from you now. We are now going to be moving from me gathering information and asking you lots of questions to me explaining what the next step is. And a phrase would be something like, thank you. You have explained everything very clearly. Now I would like to explain how we can investigate this. A really useful use of signposting is asking permission. So this is especially useful for when you need to ask about sensitive topics. For example, I'm afraid I need to ask you some personal questions, for example, relating to sexual activity. Would that be okay with you? And by using a signposting question to tell the patient that the next questions are going to be sensitive, it gives them a chance to mentally prepare for these sort of questions. And it also actually gives them a chance, maybe they'll say, look, I really don't want to talk about this at this time. They may say, actually, I'd prefer to discuss this with a doctor of my own gender. And it's very, very useful rather than you just asking the difficult question and then putting them in a difficult situation. And clearly they are going to answer in an OET situation, but you'll be getting that big tick for empathy and using a very useful phrase. And this is also useful for when breaking bad news or dealing with those difficult, sensitive topics regarding end-of-life care, patients who are very, very unwell. And we can, when talking to the patient or the relatives, say something like, I know this must be very upsetting for you, but can I go through with you what will happen if this treatment doesn't work? And again, by asking the signposting question, we're allowing the patient or the relative the option to say, oh, I'd like another family member in with me, or I'm really not ready to discuss it this time. Can I have even a few hours to think about this, and can we come back and discuss it? And finally, using organization techniques in explanations. And there's a few techniques here that if the card is appropriate, the OET want you to be able to demonstrate that you can do these skills to get the top marks. So categorization, and that's just simply if you have a long list of things, we've all seen those OET practice cards where there's lots and lots of things to cover, that you can tell the patient in advance the categories you're going to talk about. For example, my recommendations include medication options and lifestyle modifications. Firstly, let's discuss medication. Another technique is labeling, and that's just using little words or phrases to show which information is particularly important. I would strongly recommend that you take this medication, for example. Or it is extremely important that you call an ambulance if you get further chest pain. Another technique is chunking. This is where if you have a lot of information to give a patient, you pause between each separate piece of information, and you can also combine this with checking in and seeing if the patient has questions as part of your explanation, not just waiting until the end of a lot of information. For example, asthma is a condition that affects the small airways carrying oxygen through the lungs. These airways become narrow, making it difficult to breathe. Do you have any questions so far? Okay, this narrowing can be helped by medication. So by giving those pauses, you're allowing the patient to ask questions, and in a real life scenario, you can be reading their facial expressions and body language and see, are they understanding this, or is it just going way over their head? Do I need to change tactic? Now, the last point is repetition and summary of important points. And this is where I come to my main tip, and even if you don't remember anything else from this video, I really want you to remember this because it's where you get the most marks. So the easiest way to show this skill is to signpost your summary. So if you do nothing else, you can use a phrase like, "We have spoken about a lot of things today. Can I briefly summarize the important points?" And this will add excellent structure to that final part of your consultation. So if the examiner is at home in their office, they've listened to about 100 exams that day, they're just trying to mark them. If they can't quite remember how well organized this was, they don't know exactly what marks to give you, then at the end, you say a phrase like this, bam, they're much more likely to give you the higher marks because you've shown that you've signposted, you've asked permission, and you've shown that you're going to summarize. Especially if you're running out of time, if this is the last thing you say and then the interlocutor stops you and says, "Sorry, we're out of time, we're going to have to finish the exam here," you've still shown that you were going to summarize, even if you don't manage to actually get to summarize. So I'd really, really, really strongly encourage you to try and use this phrase or a similar phrase at the end of every consultation that you are practicing for the OET. So those are my recommended phrases for providing structure for the OET. Now, we've spoken about quite a lot of things and covered quite a bit in this video. So I would like to summarize my main points. See what I did there? Firstly, don't underestimate the power of holding a good structure and showing the examiner you have a good structure, as it will help you get extra marks elsewhere. Secondly, signposting, particularly useful in any of the trickier areas of communication skills, such as sensitive topics or moving between very different topics. And thirdly, remember to signpost your summary, as that's the way to kind of turbo boost your marks at the end of a consultation. Thank you very much. As usual, if you have any questions or comments, let me know in the comments below. I try and reply to absolutely everybody. If there's any particular other videos you would like to see, again, let me know in the comments. I have a big long list of videos I want to make, but I'm always adding to it and I will get around to all of them in the end. And of course, hit subscribe, hit the like button, really helps me out. And check out some of my other videos. Best of luck with your OET exam. Bye!